Good afternoon. Today's lecture is by Dr. Azmat Sayed, who will be speaking on laser therapy. Dr. Azmat has completed her Bachelor's of Physiotherapy from East Point College of Physiotherapy, RGUHS. Before we start the session, I request everyone to mute their mics to avoid any disturbance and save your questions till the end. Over to you, Dr. Azmat.
Thank you. Good afternoon, everyone. Thank you, Dr. Josian, for the introduction. So today I'll be presenting the topic on laser therapy. Laser therapy is a widely used modality in physiotherapy which promotes tissue healing, cellular regeneration, and inflammation. So first we'll speak about the history of laser therapy. In 1960, Albert Einstein proposed the concept of stimulated emission. 1954, Charles Downs developed the MASER, which is the microwave amplification. On 1960, Theodore Maiman developed the first UV laser. 1967, Andre Mester introduced laser in medicine for wound healing. And 1970s, the development of low-level laser therapy was introduced, and presently it is widely used in physiotherapy for pain relief. It is light amplification by stimulated emission of radiation. It is a non-invasive electrotherapy modality which uses monochromatic coherent biomodulation, which is cellular stimulation, promotes tissue healing and reduces pain and inflammation. So there are types of laser therapy. So there are three types. First is based on power, second is based on medium, and third one is based on hazards. So first one, based on power, there are two types. First is low power and the high power. So in low power, the wavelength, there are two types, which is soft or cold laser, which is used as a non-thermal effect for pain relief and healing. High power, which is mostly used in surgical, or it's also called as surgical laser. It provides thermal effect and it is used in surgery. The second one is based on medium, which can be solid, gas, semiconductor, or liquid. And basically we use the semiconductor type of laser. And third one is based on hazards, which are class 1, class 2, class 3A, class 3B, and class 4. So what is photobiomodulation? So this is the key principle used in laser therapy. So definition is, it is the therapeutic use of low level light to stimulate cellular function and promote tissue healing. Its mechanism includes which it increases the ATP production in mitochondria, thus which reduces the oxidative stress and inflammation, and then it promotes tissue repair and regeneration. It can be used in tendinopathies like tennis elbow, Achilles tendinopathy, osteoarthritis, muscle pain and inflammation, wound healing, and post-surgical recovery. So parameters includes wavelength of 600 to 1000 nanometer, which provided to the target area, and session frequency. And benefits includes pain reduction, improved tissue repair, faster functional recovery, and it is supported by multiple RCTs and systematic reviews showing efficacy in musculoskeletal conditions. So photobiomodulation, it is a key principle which is used in laser therapy. It provides therapeutic use of low level light to stimulate cellular function and promote tissue healing by increasing the ATP production in mitochondria, and thus this reduces the oxidative stress, and then it promotes the tissue repair and regeneration. So this is the electromagnetic spectrum. So we have electromagnetic spectrum which ranges from the lower wavelength to higher wavelength, and laser therapy falls between infrared to red region, and the shorter the wavelength, the more deeper the penetration it is. So we can see here infrared and red. So laser therapy falls in this, and therefore the photobiomodulation effect is produced. Now, what is the difference between a lamp light and a laser light? So, in lamp light, there are many wavelengths which is multidirectional and it is incoherent. Whereas in laser light, the wavelength is in one direction, which is it produces only a single wavelength. It is directional and it is coherent. So, now we come to properties of laser. So, there are three properties of laser. First one is monochromaticity, second is coherent, and third one is collimation. So first one, as the term suggests, monochromaticity, which produces single wavelength, which allows precise and targeted treatment. Second one, coherent, which is the light waves travel in the same phase and direction, resulting in organized and focused energy delivery. Collimation is the laser beam is parallel with minimal divergence, enabling deeper penetration without spreading. So monochromaticity, coherent and collimation. There are three properties of laser. Now how this laser therapy works? So when we provide the laser light application into the targeted area, the cells, that is the chromophores in the mitochondria, absorbs this laser light, which results in increase in ATP production, and therefore the cellular activity and protein synthesis also increases. This helps in increasing the tissue repair and regeneration. Therefore, the inflammation and the pain relief is decreased. So this is the mechanism of action. So whenever we apply laser light, the chromophores in the mitochondria they absorb those laser light, and ATP production increases, cellular activity increases, protein synthesis increases, tissue repair and regeneration increases, and therefore there is decrease in inflammation and pain relief. What are the indications of laser therapy? So any conditions which has tendinitis like the tennis elbow, Achilles tendinitis, muscle strain and ligament sprain, joint pain like shoulder, knee, back pain, osteoarthritis, bursitis, soft tissue injuries, post-surgical healing, wound healing, trigger points and myofascial pain. So these are the parameters and dosage of laser, so which includes wavelength, power, energy, mode, time or duration, frequency and the spot size or the area. So wavelength unit is nanometers and typical range is 600 to 1000 nanometer. So for the red laser, the wavelength is 600 to 700 nanometer, which is effective for superficial tissues, and infrared, which is from 780 to 1000 nanometer for deeper penetration. Power, which is milliwatts, typical range is 5 to 5000 milliwatts. So for low level lasers, 5 to 500 milliwatts is the range, and for high power lasers, 1 to 5 watts is the range. Energy or dose, which is joules per centimeter square, it determines the amount of energy delivered, and we should avoid overdose. So mode, it can be continuous and or pulse. So continuous provides thermal effect and pulse provides non-thermal effect for the deeper penetration. Time, it can be 30 seconds to 10 minutes per point. It also depends on area size and desired energy density. Frequency, we can do according to the patient concern. So it can be 1 to 5 times per week. The frequency of the treatment, it also affects the healing rate. And spot size or area, it can be in centimeter square, 1 to 10 centimeter square, which affects energy density. So smaller the area, higher the intensity per centimeter square. What are the physiological effects? So first one is angiogenesis and new vascularization. An increase in oxygenated blood to the injured tissue accelerates tissue healing. Then second one is it increases the collagen production. Proper alignment and remodeling of collagen reduces internal scar formation and enhances the tissue elasticity. Third one is it increases muscle regeneration and muscle atrophy. Repair of damaged muscle fibers and activation of myogenic satellite cells leads to regeneration of the muscle tissue. Fourth one is decreases inflammation and edema. So increase in inflammatory mediators such as macrophages, neutrophils and lymphocytes accelerates and resolves the inflammatory process. increases nerve regeneration, proliferation of the growth factors, promotes neuronal sprouting and myelin formation for optimal nerve recovery. Then it also increases cartilage production due to increase in chondrocytes and collagen production, which allows for improved cartilage deposition and joint function. And the last one, it increases bone formation, proliferation of osteocytes and remodeling of the bone extracellular matrix results in accelerated bone repair. So these are the physiological effects which is provided by the laser. So the one which we use in our clinic is the HMS laser. So the features are, it has wavelength of 810 nanometers, which is nearly to infrared, and therefore it penetrates the deeper tissues. And we have two modes. One is the continuous or the pulse, and it can be applied to musculoskeletal injuries, tendinitis, joint pain, wound healing. And for safety purpose, we have to always use a protective goggles to follow its preset energy limits. And it also has a handheld probe for targeted treatment. How do we apply? So there are various techniques which we use in laser. So first we ensure comfortable and stable position of the patient. Then for the machine setup, we adjust the wavelength, mode, power and time before starting. Point. So there are four types of techniques. First one is the point technique, where the laser is directly applied on a specific point, the tender spot or the trigger point. So here the probe is in direct contact with the skin and you have to hold it steadily for around 30 seconds. Second one is scanning technique. Laser moves slowly over a larger area in a sweeping motion, and we divide the area, move the probe at a steady speed and keep consistent distance. Third one is the grid technique. Target area is divided into a grid and the laser is applied systematically to each square. Then the fourth one is contact versus non-contact. So the probe touches the skin. Hello. So in contact versus non-contact, here the probe touches skin or held slightly. Here the therapist has to use goggles for patient and therapist, maintain correct distance if it is non-contact. So the first one is the point technique. So here we take the laser probe directly onto the skin of the patient, targeted area of the patient. Next one is the non-contact technique. So here we keep the laser probe 1 to 2 centimeter away from the skin. Third one is the grid technique. So here we ask the patient where the patient feels pain, and we mark the points in the form of grid, and we give 30 seconds to one point and then we can move to the another point. So a case example as in a tennis elbow. So here the adult is coming with the case of lateral epicondylitis, which is a tennis elbow, and symptoms will be pain over the lateral side of the elbow, and it's getting worse with gripping or lifting. So in assessment findings, we can see tenderness at lateral epicondyle, and there is pain on resisted wrist extension. So how do we apply laser? We can do point technique or grid technique over the lateral epicondyle. Parameters used 810 nanometers wavelength, pulse mode 30 seconds per point, or we can adjust. Then expected effects, it can reduce pain, decrease inflammation and accelerated healing. So there are recent advances which suggest the improvement of the patient using the laser therapy. So first one is the effects of 904 nanometer low level laser therapy in management of lateral epicondylitis. So it was published in 2007, Photomedicine and Laser Surgery. Wavelength was 904 nanometers, so 0.27 joules per point. 9 sessions were taken. Laser was applied to tender points over the lateral elbow, and it was given with the exercise regimen. Outcomes were there was significant pain reduction, improved grip strength and function versus the placebo, and low level laser therapy at 904 nanometers combined with exercise boosts the function and reduces pain in tennis elbow. Second one is efficacy of low level laser therapy in low extremity tendinopathies and plantar fasciitis. So it was published in the year 2022, and wavelength was varied across trials. Recommended doses range were followed, and multiple sessions were taken. Pain measured at the end of the therapy and 4 to 12 weeks later, with exercise low level laser therapy as an add-on to exercise versus the exercise alone. Key outcomes: it has reduced the pain and disability reduction both immediately and weeks later. So low-level laser therapy effectively reduces pain and disability in tendinopathy and plantar fasciitis, especially with exercise. Third one was a study which includes the systematic review and network meta-analysis on low-level laser therapy for knee OA symptoms. It was published in 2024, Aging Clinical and Experimental Research. Focus was on identified optimal wavelengths for knee OA symptom reduction. Multiple sessions were given. Low-level laser therapy was applied over the knee joint superficial tissues, and outcomes was there were certain wavelengths which were near the infrared, which showed better pain and function outcomes. Take-home messages: it helps in optimizing the wavelength selection, which may improve the low-level laser therapy, which is benefit in knee OA. Fourth one is effects of local laser therapy on plantar fasciitis. It was published in the year 2026, Journal of Clinical Medicine. Condition was plantar fasciitis. Application was included studies used low-level laser therapy photobiomodulation protocols compared with the placebo or other interventions. Sessions reviewed. There were multiple randomized clinical trials. Protocols varied. And effectiveness, significant reduction in heel tenderness, but overall pain and function results were inconsistent across the studies. So laser may help tenderness in plantar fasciitis as an adjunct therapy, not a primary treatment. Larger standardized trials are needed. So references, these are the references which I had used throughout the presentation. So take-home message is laser therapy, it reduces pain and improves function in musculoskeletal conditions and tendinopathies. Low-level laser therapy works best when combined with exercise, effective for tennis elbow, knee OA, plantar fasciitis. Application parameters like the wavelength, dosage, target points and session frequency are critical for a successful treatment. Then low-level laser therapy is generally safe with minimal side effects. It is best used as an adjunct to physiotherapy, not as a standalone treatment, and it is supported by various randomized control trials and systematic reviews, which is effective in tennis elbow, knee OA, plantar fasciitis, shoulder impingement. I would like to summarize. So, laser therapy. It is a light amplification by stimulated emission, non-invasive, uses monochromatic, coherent and light energy, causes photobiomodulation, promotes tissue healing, reduces pain and inflammation. There are types of laser which is based on power, medium and hazards. Then photobiomodulation, which is the key principle used in laser therapy. Then the electromagnetic spectrum, where the laser therapy falls between the range of infrared and red region. And the difference between the lamp light and the laser light. So lamp light, there are many wavelengths, multidirectional, incoherent, whereas in laser light it is monochromatic, directional and coherent. The properties of laser, which includes monochromaticity, coherent and collimation. Monochromaticity, single wavelength; coherent, light travels in the same phase and direction; and collimation is the laser beam is parallel with minimal divergence, so which helps in deeper penetration. The mechanism of action of laser, from the laser light application to decrease in inflammation and pain relief. Then indications: tendinitis, muscle strain, osteoarthritis, bursitis, soft tissue, post-surgical healing, wound healing, trigger points. Then there are various parameters, which includes wavelengths, power, energy, mode, time duration, frequency, and the spot size or area. The physiological effects are HMS laser, which includes a wavelength of 810 nanometers. So there are four application techniques, which are the point technique, scanning technique, grid technique, and contact versus non-contact. Point technique, the laser probe will be touching the skin, it will be coming in contact. Non-contact technique, there will be a 1 to 2 centimeter gap from the targeted skin to the laser probe. And grid technique, which there will be grids marked on the skin, and accordingly we give 30 seconds of deeper penetration onto that targeted spot, and then we shift. And also we saw a case example of a tennis elbow, where the laser was applied to a point or grid technique over the lateral epicondyle, 810 nanometer wavelength, pulse mode, 30 seconds per point. Also, we saw 5 recent advances which suggest that laser therapy is very effective in tendinopathies, inflammatory conditions. Yeah, that's it. Thank you.
Thank you, Dr. Azmit, for your informative lecture. Does anyone have any questions?
Hi, good afternoon. Azmat, very good presentation. Good job. I just have a couple of questions when we were talking about the types of makeup. So a lot of people in physiotherapy are starting to use also different classes of laser. Can you explain that?
So there are different class of laser: class 1, class 2, class 3, class 3B, and class 4. So this is based on hazards. So class 1 will have a lower wavelength, and the class 1 will have a higher wavelength, and class 4 will have a lower wavelength. So the lower the wavelength is, higher the deeper penetration. So normally we use class 3B in the treatment purpose, and higher the classes, that much better it is in the treatment. It provides more efficacy in the treatment.
So the lower the class, the deeper the penetration. And class B lasers are normally what we use.
Yes, ma'am. So normally we use the semiconductor type of laser, gallium arsenic, but now recently people are also using class 3, class 4 lasers also.
Okay. And the HMS belongs to which category?
It is a class 2 laser and with the wavelength of 810 nanometers.
Okay, it's a class 2.
Yes, ma'am.
Oh, alright. Can carry.
Yes, ma'am.
Do we have any more questions?
Are there any studies that compare the effectiveness between the classes?
Ma'am, I have to book on it. See on
Yeah, that would be a good thing to check out.
Okay.
Whether there are any comparative studies between classes.
Okay, ma'am. Yes, ma'am.
Okay.
With this, we conclude our session. Thank you, Dr. Azmit.